Hello, my name is Dr. Rylan Russell, and I am a PGY4 Emergency Medicine resident at OSU MC in Tulsa. Today, I'm excited to share a project cleverly titled QIQEYE, Quality Improvement Project of Ocular Related Complaints in the Emergency Department. This project was a collaborative effort with fellow resident PGY4 Dr. Tanner Hessman, PGY1 Dr. William Redman, PGY1 Dr. Dalton Sanders, and under the guidance of attending physicians Dr. Charles Harris and Dr. Kenneth Argo. Throughout my 4 years of residency, I noticed that a lot of residents, even myself, felt a little uneasy, almost apprehensive about evaluating and managing ocular related complaints in the emergency department. To some degree, some of the residents, maybe some of the younger residents, even had this showcasing of avoidance or dread when an ocular related complaint was checking into the emergency department. And honestly, it's understandable. They can be intimidating, they can be elusive to provide appropriate diagnoses. Um, as a whole, ocular complaints can be quite nuanced and can cite a lot of fear in um, missing a vision threatening diagnosis. Um, and then, of course, this discomfort can lead to unnecessary testing, misdiagnoses, longer ED stays, and overall lower patient satisfaction and lack of quality care to said patient. This isn't just an isolated problem. I think that fear of ocular related complaints can be experienced both by resident physicians as well as experienced attending physicians. Um, a national sample from 2010 showed that ocular related complaints make up about 1.5% of all US ED visits. That's somewhere around 646 visits per 100,000 people. Given this prevalence, I thought to review our own residency curriculum in regard to ocular emergencies and honestly found it to be lacking. I just did not feel like there was enough structured training to build true confidence in this area amongst our current residents. So we set out with a primary aim: one, to assess our current residents' comfort levels through a pre-survey, and second, to address the gaps through targeted educational interventions addressing that initial survey. The survey that was sent to our current residents in the OSU ER program asked and evaluated 9 particular components to include knowledge of eye pathology and related complaints in the ED, obtaining visual acuity with accuracy, performing a slit lamp exam and indications to do so, obtaining IPH and ocular irrigation techniques for chemical exposures, performing an ophthalmoscopic exam, removing a retained ocular foreign body, obtaining intraocular pressures and indications for measurement and when to do so, performing a lateral canthotomy and its indications to do so, and consulting with an ophthalmologist in regard to physical exam findings and procedures performed. After this survey was completed by current OSU ER residents, and based on the results, we developed a focused educational curriculum, including lectures by a third-year ophthalmology resident at OU Dean McGee, lectures provided by OSU ER board certified attending physicians, lectures provided by senior level OSU ER residents, as well as I provided hands-on skills lab. After implementing these interventions, we distributed a post survey. Both the pre and post survey assessed degree of comfortability with markers to include not at all comfortable, somewhat comfortable, mostly comfortable, and very comfortable. As detailed here in the results section, this information has been displayed in bar graphs as a comparison of the pre and post survey results following this targeted intervention. Without talking about each isolated survey question, I'll say as a whole, there is a trend of improved comfortability essentially across the board, most notably seen in performing an ophthalmoscopic exam, performing a lateral canthotomy, performing foreign body removal, and utilizing the slit lamp. As discussed, our primary goal was to enhance resident comfort and competence in managing ocular-related complaints through a improved and more robust and more structured curriculum amongst our own residents. Looking forward, we hope that this improved competence and comfortability translates to improved quality care of patients presenting to the ED for ocular-related complaints. We would anticipate and hope that this would lead to more accurate diagnoses, elimination of misdiagnoses, reduced ED length of stay, and overall improved patient satisfaction. Secondarily, we hope that this can propel more research into assessing that um, and those factors after providing on an annual basis a pre and post survey to incoming residents. Again, I think that this project also underscored the importance of regularly evaluating residency curriculum to ensure we're meeting the evolving needs of both residents and patients. I think this entire model of providing targeted skills focused education and skills focused hands-on skills labs um, can be adapted to other challenging areas of emergency medicine just based on the current residency program's comfortability in regard to any specific subject, procedure, or any complaint of a patient presenting to the emergency department. Um, Overall, we are very happy with this project, and we are thankful for the OSU Emergency Department residents and attending physicians for their guidance and participation in this project. Our references and acknowledgments are detailed in the right lower side of this poster. And I'd like to give a special acknowledgement to Dr. Kelly Murray, PharmD, pharmacist of the emergency department, who played a crucial role in um, allowing us to complete this project. Again, thank you so much. I appreciate it.